If you're watching this, you've probably already seen a million videos about artificial intelligence taking over the world. But what if I told you that researchers just made a major breakthrough in fighting one of the world's deadliest cancers? We're not talking about some distant futuristic fantasy. This is happening right now in labs around the globe. Today, I want to tell you about a hidden survival switch inside cancer cells and how scientists might just found a way to destroy it. Let me paint you a grim picture. Every year, more than 1.4 million men worldwide are diagnosed with prostate cancer, and nearly 400,000 lose their lives to it. That makes it one of the deadliest cancers for men, second only to lung cancer. In its early stages, prostate cancer is often manageable through surgery, radiation, or hormone therapy. But here's the chilling truth. Within 5 years, as many as 20% of patients develop treatment resistance, and when that happens, the disease becomes extremely difficult, sometimes impossible to control. After that point, survival rates plummet dramatically, so finding new ways to beat resistant prostate cancer is desperately needed. And in recent years, researchers have been homing in on a promising lead, a previously unknown survival mechanism inside cancer cells. This mechanism revolves around a little-known enzyme called PI5P4K alpha, a mouthful to say the least. Normally, it plays a role in controlling how our cells use lipids, which are essential for everything from storing energy to protecting organs. But inside cancer cells, this enzyme takes on a darker purpose. Scientists have found that when traditional cancer treatments are used, PI5P4K alpha steps in and helps cancer cells survive. It's like a backup fuel system kicking in when the primary one is disrupted. That makes it a perfect candidate for a new drug target. Now here's where things get really interesting. This enzyme appears to play a pivotal role in something called castration-resistant prostate cancer, or CRPC. This happens when prostate cancer cells evolve to survive without the male hormones they used to rely on. You see, most prostate cancers start off dependent on androgens, which are the male sex hormones that signal for cells to grow and divide. Doctors have known this for decades and developed a treatment called androgen deprivation therapy, or ADT, which basically starves the tumor of these hormones. But as you might have guessed, cancer cells aren't keen on being starved. Over time, they manage to find other ways to survive and grow, even without the fuel they once depended on. And that's where PI5P4K comes in. Researchers think that it helps cancer cells sense and respond to changes in their environment, allowing them to survive under conditions that would normally kill them. It's like a built-in GPS that helps them navigate the challenges thrown at them by cancer treatments. And the scariest part, it seems that when this enzyme kicks in, cancer cells become pretty much unstoppable. But the good news is that this survival mechanism also makes them easier to target. If we can find a way to turn off PI5P4K, we might have found the key to beating even the most stubborn forms of prostate cancer. So that's what scientists have been doing, hunting for ways to turn off this dangerous enzyme and starve off resistant cancer cells, and they're not alone. Thousands of researchers around the world are on the hunt for new ways to fight cancer, driven by the hope of saving countless lives and eradicating this deadly disease. And that brings me to the latest findings from a team of researchers who believe they've found just such a way to defeat this enzyme. What's more, they claim that it won't harm healthy cells, meaning it could soon become the foundation of a new cancer therapy. But how did they do it? Well, the answer lies in a groundbreaking new paper published in Nature Chemical Biology. Here's a quick summary. The team used a technique called virtual screening to identify compounds that could bind to PI5P4K alpha and shut it down. Virtual screening is like a computer-powered matchmaking service for molecules. Researchers input a target molecule, in this case, the troublesome enzyme, and then screen thousands of potential drug candidates to find the best match. When they hit pay dirt, they then test these top contenders in the lab to see how well they work. And after years of searching, they identified a small molecule that showed promise. They dubbed it STF0, and it appears to be a pretty good fit for the job. Laboratory tests revealed that STF0 effectively neutralized PI5P4K, leading to a significant drop in tumor growth. What's more, they found that this process didn't harm healthy cells, which is a huge win in the battle against cancer. That's because cancer cells tend to rely on this enzyme much more than healthy ones, making it a more attractive drug target. So this molecule seems to tick all the boxes. But that's not where the story ends. They also tested it on mice with advanced prostate cancer, and the results were even more impressive. In this model, STF0 shrank tumors by 50% and helped mice live longer than those that didn't receive the drug. While it's early days, this could be a huge step forward in the fight against prostate cancer. If further testing goes well, this small molecule could soon be the basis of a new drug that helps patients stay alive longer and improves their quality of life. But this isn't just about prostate cancer. PI5P4K seems to be active in many other cancers, too. Breast cancer, skin cancer, and pancreatic cancer, which is notoriously hard to treat, have all shown signs of relying on this enzyme. So one day, this discovery could lead to treatments for a whole host of deadly diseases. Of course, it's important to remember that research takes time. There are still a lot of hurdles to overcome before this drug hits the market. But the fact that scientists have come this far is hugely exciting. It shows that, with enough determination and hard work, we can unlock some of the deepest mysteries of the human body and find new ways to treat some of the world's most challenging diseases. So here's to hoping that this research leads to real-world results and helps save countless lives. As we look to the future, it's clear that we're entering a new era of medicine, one defined by precision and personalization. The days of a one-size-fits-all approach are over. Today, we're learning that even within the same disease, there can be vastly different causes and triggers. That means that effective treatments must be tailored to each individual patient. Fortunately, we're now better equipped than ever before to do just that. Take prostate cancer, for example. We've known for some time that not all prostate cancers are the same. Some grow slowly and may not need immediate treatment, while others progress quickly and require more aggressive care. But until recently, we didn't have a way to easily identify which was which. That's all changed thanks to advances in genetic testing. Now we can analyze a patient's tumor to determine exactly what kind of cancer they have and develop a treatment plan that is specific to their needs. It's like having a GPS for cancer treatment. It pinpoints exactly what needs to be done and helps doctors avoid wasting time and resources on unnecessary procedures. But that's just the start. Genetic testing can also help predict how a tumor will respond to certain drugs. That means that patients no longer have to undergo a trial-and-error process to find the right treatment. Instead, doctors can use genetic testing to select the most effective drugs up front, increasing the chances of success and minimizing side effects. And it's not just prostate cancer. This approach is being used across a range of diseases to tailor treatments and improve patient outcomes. In breast cancer, for example, genetic testing can help identify patients who are at higher risk of developing the disease. This allows for more frequent screenings and earlier interventions, which can significantly improve survival rates. Similarly, in ovarian cancer, genetic testing can help predict how the disease will respond to certain chemotherapy drugs. This allows doctors to avoid using drugs that are unlikely to work and focus on those that have the best chance of success. Of course, there are still challenges to overcome. Genetic testing can be expensive and time-consuming, and there are concerns about privacy and discrimination. But the benefits are too great to ignore. As technology improves and costs decrease, genetic testing is becoming more accessible, putting the power of personalized medicine into the hands of more patients. The future of medicine is bright, and it's all thanks to advances in genetic testing. Who knows, in the not-so-distant future, we may be able to cure some of the world's most dreaded diseases. All thanks to our DNA. Thank you for watching my video. Subscribe to the channel to learn more about frontier discoveries and groundbreaking research that are changing the world.